Thanks for joining us on This Week in Health IT Influence. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Today we have Tom Barnett, the CIO and CDO for Baptist Memorial Healthcare. Special thanks to our Influence show sponsors, Sirius Healthcare and Health Lyrics, for choosing to invest in our mission to develop the next generation of health IT leaders. If you want to be a part of our mission, you can become a show sponsor. The first step is to send an email to partner@thisweekinhealthit.com. A quick note, we launched a new podcast, Today in Health IT. You're not going to find it on This Week in Health IT podcast feed. It's a new channel. It's its own show. We look at one story every weekday morning. Check it out. It's roughly about 6 to 8 minutes long. It's an easy way to stay current on what's going on in the health IT space. Subscribe wherever you listen to podcasts, or you can hit our website, thisweekhealth.com, hit the subscribe button, and it'll show you how to find the podcast. If you're new to this show or returning after a while, we now do 3 shows on this channel on This Week in Health IT. On Monday, we cover the news, and I do that now with a round robin group of about 6 to 8 people. So it's a back and forth on the news and what's going on. On Wednesday, we have an influence or a solution showcase episode, and every Friday we're going to do an influence episode just like this one. Be sure to check back for more great content. And now on to today's show. Today we have Tom Barnett, the CIO and CDO for Baptist Memorial Healthcare out of Memphis with us. Good morning, Tom, and welcome to the show.
Good morning, Bill. Glad to be here.
Yeah, I'm looking forward to this conversation. So before we get started, this is the second time you've been on the show, but you're now with a new organization. So talk to us a little bit about the move. How do you like Memphis so far?
Oh, I love Memphis. I love the weather, especially this time of year. So
yeah, and you came from upstate New York, right?
Absolutely. Great area, great folks, but it also has 104 inches roughly average snowfall per year.
Oh man. So when did you make the move? How long have you been down there?
I've been down here since the last week of May.
Do you have a favorite restaurant yet? One of the things Memphis is known for is restaurants.
Oh, for me, it's barbecue. I've been working my way through the barbecue restaurants here. I love it.
No, that's fantastic. So we're going to talk a lot about the digital side. We'll talk a little bit about COVID and what's going on, because you, as we were talking earlier, you experienced COVID in New York, having made the transition in May, and then you experienced a couple peaks in Memphis when you got down there. So you seem to be hitting the peaks in these various locations. So we'll touch on that a little bit. But before we get there, tell us a little bit about Baptist Memorial.
Sure. Well, Baptist Memorial is Baptist Memorial Healthcare Corporation is a 22 hospital health system based out of Memphis, Tennessee. But their markets are pretty much Western Tennessee, basically mid to northern Mississippi, as well as Northeast Arkansas. We've got about a 4,000 member physician network and associated ambulatory clinic network as well.
Wow. So Mississippi, you are hitting some places that have some escalated levels of COVID even right now, I would assume.
Yes, we're seeing our second spike that we're kind of going through right now, which has actually eclipsed the COVID spike that their first one that they had, which really peaked kind of in the late June timeframe.
Wow. All right. Well, here's what I'd like to do with you. You have one of those interesting roles, and I want to sort of talk about that. So the CIO CDO role, what does that entail? What is the combination of those two things at your health system?
They're actually very related. So from the CIO perspective, obviously keeping the core systems and roadmap for the health system and their strategic direction for the future in place, but digital in order to now begin that. And digital means you could probably ask 5 different health systems, you might get 6 different descriptions. Yeah. From our perspective, it's primarily from the patient engagement perspective. So making sure that encompasses everything such as, I know a lot of terms different organizations use include digital front door, but all of those patient engagement technologies and how health systems interact with their patients as well as providing that care digitally. But it also has a secondary focus as well, which I think has come to the fore as part of the pandemic this year, and that's digitally engaging our workforce as well for new ways that they're working. So I think it encompasses both hats of that.
Yeah, it's interesting you talk about that. Digital definition is something that eludes us, but it is at that intersection of how people interact with our health system, either the caregivers, the care providers, or the patients, and enabling that with all sorts of technologies where they can do visits, they can pay bills, they can do inquiries, all the things that they used to do, face to face, in person, send a mail, send an email, now are becoming tools that are tightly integrated into the operation. And it's interesting to watch because you're right. It's very different. The reason I point that out is the CIO CDO role is still interesting in the IT world. There's some organizations that are going with both. There's some organizations that are going with combined, and there's some organizations that just call it a CIO, but they also have taken on the digital roles. So that's why I highlight that. Does your digital group have sort of an objective statement or a mission statement around the digital initiatives?
In a sense, we have an informal one. We're working through what those digital roadmaps look like as I'm getting into this role and kind of defining what this space means for us. Overall, I would say it's meeting the patient where they're at and allowing them to digitally engage with us for their care in the easiest fashion possible.
So do you have a team? Do you have I mean, clearly you have a CIO has a lot of teams around the operations and informatics and those kinds of things. But do you have a team that's dedicated to digital by itself?
We're in the process of building that team out. So a lot of those skills and those disciplines are within the existing IT team that we have today. So we're very much around assembling teams around initiatives to be able to move forward on different aspects that we need to work with. As we need to build out additional skill sets internally, we'll look to figure out how we come up with a more dedicated team for the areas that need it.
So let's just talk generically, maybe even across your previous health system and this one. What kind of projects have come to the fore during a pandemic? What kind of things are we doing to reduce the touch points and those kinds of things?
I think it's reducing the touch points, and it's a lot to your earlier statement about things that patients did with us in person previously that they now want to do digitally. And the pandemic really became a catalyst for that. So from our perspective, it's definitely working through, and I think this is similar with a lot of health systems. As the pandemic began its onset earlier this spring, video visits, which may have been a curious technology before, or telehealth, suddenly took a spike, and it suddenly became a very fast-growing area. So you were either ready for it or you weren't. And I think that's consistent with both health systems that I've been with this year. They were both poised to be able to take advantage of that, to be able to help those patients who necessarily maybe did not want to come into a healthcare setting for risk aversion reasons, but now we're able to engage with that physician digitally through video visits.
What areas, so we saw the spike in terms of telehealth. I mean, the numbers were just staggering and amazing, but we also saw it come back down. Are there areas where telehealth is really taking hold and you see that the future is really clear, and other areas where you're like, okay, we may have some work to do here. We still have to figure some things out?
I think it's going to depend on the individual use cases. So obviously things that will lend themselves to a video visit, follow-ups, potentially certain dermatology types of visits, certain sub-medical specialties, possibly. But that becomes a big convenience factor, not only for the provider, but for the patient specifically, in order to be able to quickly get that diagnosis or that follow-up that they're looking for. In terms of ongoing patient monitoring and so forth as well, I think as you look toward keeping those touch points lighter in this post-pandemic world that we're in, any of those types of transactions that can be made frictionless or a quick speed, if you will, from that interaction, definitely lends itself to digital. And we're looking at those as we look at our use cases to figure out which ones are the best candidates to become digitized.
So has Baptist Memorial gotten rid of all clipboards and pens? Are we at that point yet?
Well, I think we have 15 that are left here, but we share them.
No, the reason I asked that question, so CVS just announced they're taking PayPal, they're taking Venmo, they're taking all those things. And part of that is the retail nature of their business. They're trying to reduce touch points, right? So even, touching that pen or using the credit card reader and that kind of stuff, they're finding that people are more amenable to solutions that they're educated now, right? So they know how germs move, not at the level that a doctor would understand the difference between a virus and other types and how things move, but they're more educated on hygiene and cleanliness, and they're more willing to touch their phone than they are the things that people are handed to them. Have you seen like a higher demand for those types of projects, or is that one of those, if you didn't have it before COVID, there's hasn't really been enough time to put anything in place?
I think that level of distancing and doing a lot of those forms online prior to getting to the office visit, in your example, anywhere that we can minimize those types of physical touch points, were already in place, and I think they've been refined since COVID has taken root. So we're looking at where can we optimize those, where can we reduce those touch points wherever possible, and even, but it's always a combination, right, of not only digital technologies, but it's people, process, and tools. So we're making sure that the social distancing is in place, how we're scheduling those clinics to make sure that we avoid a lot of folks being in the same waiting room at the same time. Anytime you can push that, and that can be a couple of different things. That can be alerts going to a phone to let patients who are waiting in their car know when they can come in for that appointment. I think we're looking at all of those different strategies as things that can be employed to make life easier for everybody. Are
you guys doing a lot with, for lack of a better term, inpatient telehealth between the clinician and the patient, but also the physician-to-physician communication? Are you using telehealth in your inpatient settings?
Absolutely. So I think with consults happening across state lines and so forth, again, particularly within this post-COVID world that we're in, we're doing a lot of those through video visits and consults. Even small things like, in order to help reduce the level of PPE equipment that we're going through as a health system, in some cases, particularly in higher touch ICU settings, we're putting tablets out there so that patients can engage with nurses directly through these kind of digital communication channels. All that allows constant monitoring, real-time interaction with the patient, but can also be sensitive to some of the environments and circumstances that we're in as well. Another area that we're looking at that was actually optimized, and it was processed, but some technology as well. We have drive-through COVID testing lanes at our main Baptist Memphis hospital. And it gets a fair amount of activity, as you can imagine. So figuring out ways that we can almost emulate, if you will, certain fast food restaurants in terms of how they manage lines. So working with our in-house process improvement team, they came up with some great strategies that allowed us to extend Wi-Fi coverage across a larger parking lot area, and then deploy tablets to allow staff to be able to register and check in patients who are waiting in their cars in these testing lanes, but all focused on increasing throughput and increasing or decreasing the amount of time it takes for folks to get a test. I think those are all aspects of where we're utilizing process improvements combined with technology to really drive some results.
Yeah, so you've been there since May. I don't think there's been a normal day since you've been there, but I'm going to press in. Some of these questions might be unfair, but I'm going to press in anyway. So from a data perspective, from a real-time analytics, dashboard, those kind of things, what kind of projects have you been fielding since you've been there?
So mostly they've been around responding to our COVID situation that we have. Not unlike a lot of health systems right now, but real-time dashboards in terms of bed utilization, levels of care, acuity levels.
Are these things you already had, or were there things you had to develop?
I think these were things that were already in place. So again, from Baptist perspective, there's a lot of fantastic tools that come out from the Epic platform. And Baptist was the first site, so if you're familiar with the STARS rating in terms of implementing Epic functionality, Baptist Memorial was the first health system in the world that hit 10 stars in 2017, and we were just recertified again this year, 2020, as a 10-star site. And as such, we have access to a lot of tools, a lot of dashboards, and a lot of enabling technologies, if you will, that can definitely be just some refinements in some cases in terms, and I'm speaking specifically to bed utilization and throughputs and acuity levels, that can definitely allow our team to make adjustments. We're also responding from a surge level as we do readiness around us. We're all watching infection cases rise. What that means for our team, yes, we are on Epic. Yes, we have been doing that for a while here. But what it also means is that as we recategorize rooms in order to adjust to changing patient volumes, that requires the Epic team as well to be able to jump in and reconfigure some of those rooms and make sure that we're working real time with operations, that those changes are reflected both in those daily dashboards as well as any reports that we need to be able to stay on top of what the overall activity level of the health system is.
Do you guys participate in the Arch Collaborative at all? Just out of curiosity.
Yes, we do. Yes, we do.
So are you doing a lot of things around the physician experience and the EHR interaction?
And absolutely. And working very close partnership with our CMIO, Dr. Jake Lancaster, who I know was on the program earlier this year. We are definitely focusing on optimization areas within physicians. So some of the things we're looking at is kind of getting and refining some of the standardized templates around physician documentation. We're also taking a look at other metrics that are available, such as time spent in the EMR outside of normal working hours and how we can set those as benchmarks to work with our in-house training team as well as our process improvement team to focus on how we reduce the amount of burden that's on those physicians to make sure that we're flowing that work through for our provider in a real-time fashion and with as many optimization points as we can input for them and keep them out of that record during downtime.
Yeah, I'm looking at this video and they really haven't given you much time to like unpack boxes or put anything up on the wall, or so you've been fairly busy since you got there?
Absolutely. So it's learning a new organization, learning a tremendous amount of talented people that I'm working with, as well as doing a lot of it, quite frankly, through this camera. So a lot of what we're doing are video visits right now. So a lot of our management staff and leaders are still on site while our staff is working in various modes of working remotely depending on the team. But a lot of our meetings are all done through, actually almost exclusively through video right now. So while it is very beneficial, you can get from one meeting to the next through a click very quickly. It doesn't allow a lot of times to unpack boxes. You're right.
I was talking to somebody, they're like, which kind of doctor makes the best CIO? And I'm like, that's easy. It's an ED doc. I said, because you can't possibly do everything they put on your plate. So you're constantly prioritizing, triaging. Yeah, I mean, you're just, there's some things you look at and go, that's important. I'm going to put that in a holding pattern because this is critical. And you're making those kinds of decisions pretty often. I think I'm going to close with a pretty big question. And and I've been asking other CIOs this question because it's interesting. You guys go in different directions. What do you think that the lasting impact on health IT is going to be as a result of the pandemic?
The lasting impact. So I think a couple of the comments that I've heard in a few of the different health systems that I've been with this year, it's operations has been very impressed with how quickly IT has been able to turn around solutions very quickly, whether it's suddenly within a few days, let's move 1,000 or 2,000 people to work remotely and clear out offices as a result of what we've all been dealing with, or drive through COVID lanes, or dealing with video solutions to be able to engage with patients. What it means for IT is we've been able to focus on things because there's been a priority and an urgency put on it. I think a lot of the other work has kind of gone to the side. So the lasting impact, I think we're all going to be looking at new ways to work, embracing digital tools on a level that probably haven't been done in health IT before, just in general, because healthcare in general is always a step or two behind maybe other industries, for example. But I think as we all look at how well the remote or the WebEx or the video world has worked for everybody, I think there's going to be an opening up of how do we do this type of focused teaming and being able to rally teams around kind of what these new strategies are and being able to implement them in a lot shorter time frames. So whether you call that DevOps or any of the other trendy words that are out there, I think there will be a clarity that comes out of this. Digitization, learning how to work remotely and focusing on all of the work and only the necessary work needed to drive a result or bring a solution into fruition. I think that clarification, as well as the catalyst that the pandemic has been, is really going to leave its imprints on our industry going forward.
Yeah, I love that. And actually, I lied because I have another question, which, how big is your staff at this point?
The IT staff, so the corporate staff, we're about between 350, 375.
So is that spread out or is that mostly in Memphis?
That group is mostly within Memphis, supporting a lot of our enterprise IT systems. We also have desktop support and a number of IT personnel embedded in each one of our hospitals. So collectively, we're probably up in the 800 FTE range.
It just, the reason I wanted to go down this path is just dawned on me. I mean, you're new into the role. There's probably people that you've literally only met this way, is my guess.
Absolutely. You might see them in the parking lot after work and not recognize them when they're not on video.
Yeah.
It's literally been like that.
And what's the most number of squares you've had on a screen as you're trying to have a meeting?
Probably, I think 20.
Yeah, and it's to a certain extent, I've heard the same thing, that it's been really interesting to be able to connect to people in this way. Very freeing for some people. Some people have long commutes, maybe not as much in Memphis, but in other markets, people have long commutes and those kind of things. They've now been given part of their life back. A lot of them are wondering like what the future, and I'm not going to put you on the spot. You haven't been there long enough to put you on the spot here, but a lot of health systems are trying to figure out what the future of work is. And it'll be interesting. We've really had to adapt. So I'm going to assume you're going to have, the next time we talk, you'll have a few more books on that shelf.
I think I will. And one of them I'm reading through right now is Ed Mark's new book on digital.
Yeah. Well, you'll have to listen to the interview as well. He sent me the book on a Tuesday, and I was interviewing him on Wednesday. So I stayed up all night. And I crammed the whole book in and had him and Patty on the show. Yeah, I love those two guys are doing great work, and I love the book. So I look forward to hearing your thoughts on it when you get done.
Hey, absolutely.
Tom, thanks again for coming on the show. I appreciate it.
My pleasure.
What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. They can subscribe on our website, thisweekhealth.com, or you can go to wherever you listen to podcasts, Apple, Google, Overcast. That's what I use, Spotify, Stitcher. We're out there. You can find us. Go ahead and subscribe today, or send a note to someone and have them subscribe. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, and Starbridge Advisors. Thanks for listening. That's all for now.